Okay, go, Licia.
Okay, so good afternoon, everybody. My name is Licia Di Pietro, and I'm a PhD student at the University of Pisa in Italy. And today I will talk to you about the UBORA platform, the platform that during this bootcamp we will use to design the different devices. So, health is a fundamental aspect of quality of life, and it has an influence on the way people integrated in and related to society. And it has an impact on education and employment opportunities. Medical technology plays an important role in improving the quality of health, being the fulcrum of an effective healthcare system. The 2030 Agenda for Sustainable Development Goals, adopted by all United Nations member states, clearly emphasize the impact of the lack of appropriate medical devices on health conditions. So there is no doubt that patients and healthcare providers in low-income countries have limited access to medical devices. And this is due to several reasons. One barrier for the accessibility of medical technologies includes the high cost of imported medical devices. Developing countries often lack funds to address their needs, and the cost of medical devices can be prohibitive for small clinics and hospitals. World Health Organization estimate that more than 70% of medical devices designed for use in the developed world don't work when they reach the developing world. Over 95% of medical equipment in public hospital is imported. There is essentially no local production of medical equipment, and when there is, it is controlled by multinational corporations, often for export. Most of the imported equipment is of very poor quality. 96% is not working just 5 years after donation, and 39% never worked due to lack of training, manual, or accessories. The most important design barrier is the lack of spare parts in the target countries. Any device designed for the developing world will be likely to stop working as soon as the first replacement part is required. For example, if a filter needs to be replaced every 6 months, then the device will likely only last for 6 months when placed in developing world hospital. And this can be because the spare parts are not available in developing countries. Another common problem is the lack of consumables, or for example, the lack of reliable power supply and water. And whereas doctors have in many cases learned to adapt their capacity to developing world conditions, engineers have not developed medical equipment design practices specifically for developing world conditions. So the overall high cost of medical devices can be linked to the patent rules, but also to their long life cycle. For example, we have to define the specification of the device, we have to design, prototype, manufacturing, we have to provide the certification, labeling, packaging, provision, installation, operation, maintenance. So the life cycle of the devices is very, very long, and each step is strictly regulated because it's very important to ensure efficacy and efficiency for the devices. So Developing sustainable technologies to reduce global inequalities can be done only taking into consideration the cultural and socioeconomical condition in which these devices will be applied. The cost reduction may help to make healthcare affordable to a larger population, which is a key process towards health equity. Compared to the traditional methods of design, the open source approach can be a possible alternative. By definition, open source means making the design, documentation, source code, blueprints, ideas, and results available for the public. Having the software, electronic and hardware design available under an open source license allows anyone to study, modify, improve, and contribute to the design, potentially leading to a very rapid innovation. The application of the open source approach to medical devices has been proved to offer a unique combination of advantages, such as increasing safety, security, robustness, and it can reduce costs. Until few years ago, the development of medical devices was essentially linked to companies and university, but now on the web, there are a lot of examples of open source devices, but only few of them are being designed following the legislation. Because yes, it's true, online you can find a lot of prototype, a lot of design for devices, but only few of them are well regulated. So, motivated by the fact that none of the aforementioned environment and collaborative design platforms provide designers with tools for guided and a systematic development process in which open source and collaborative design strategy play the central role, we decided to design this platform, UBORA. UBORA, which means excellence in Swahili, is a European project with the aim of creating this platform to help the designers to design medical devices compliant with the current European regulation. So the collaborative design environment of UBORA provides features that are oriented to guiding developers through a systematic engineering designing process focused on patient safety and compliant with the international regulations. In this sense, UBORA proposes innovation through education and supports not only the access to affordable health technologies, but also participation into rewarding formative activities following the principle of engineering education for all. Which is in line with the Sustainable Development Goal number 4. In fact, during the years of operation of the project, the UBORA infrastructure has supported the teaching of open source and collaborative approaches to biomedical engineering for a total of something like 100 engineering students from more than 20 countries and 30 universities within the framework of 2 different UBORA design schools, and we have motivated also the students to submit projects, and now on the platform there are a lot of projects that are shared with the community. So if we look the life cycle of the device, in which place we can put the UBORA. So considering the overall life cycle, through UBORA, we can operate since the first step of the design, which means that starting from the device design based using an open source approach, we can take into consideration the most relevant international standard, and in this way we can reduce the cost and we can provide a more affordable technology. The impact and the potential of UBORA can be appreciated if you visit the platform, and in particular if you interact with other users and mentors. This is what we will do during these 2 weeks. And the platform, we will help you to design your device step by step. And during this work process, mentors will help you to design and to be sure that you are designing a device is compliant with the legislation. So this is the interface of the platform, and you can find a link. So actually, how it is organized? Well, in the UBORA platform, we have 5 important sections. The first one is the well, actually, in the UBORA platform, we have 2 parts. One part is related to the clinical needs. So, for example, I have a problem, I have a clinical needs, I want to share with the community which is my need. And then you have also the opportunity to give an answer to this need. So there is also a part where you can actually, design the device. The clinical needs section, as I mentioned before, is aimed at identifying bioengineering design specification linked to a particular clinical need. This section provides a unique environment for healthy discussion between patients, healthcare providers, and engineers to ensure that the clinical needs are turned into safe and affordable projects. The other main section is the section for the project management, which and through this section the users design the device. We have 6 work packages starting from 1 to 6, and during this presentation we will go more in depth in each of them. So another important thing to say is that the way in which you design the device using this platform follow the ISO standard 13485, which is the gold standard to design a good medical device. And as you can see also on the slide, this project management actually help the designers to answer to each step for a good design. Here, for example, there are listed the subsections that you can find in work package number 1. One of the most important tools that UBORA provides is the device classification, because through this tool you are able to classify your device according to the European regulation, because we will talk about it on Wednesday during the class of standard and regulation, but just to give you a brief introduction, in Europe, but also in US, everywhere actually, the devices are classified according to their risk. So the risk class for a thermometer is different for the class, for example, for a defibrillator. So they are two medical devices, but they are of two different classes. And the class is very important because it identifies the route that you have to follow to put the device on the market. So for example, in Europe, we have to classify our device starting from class 1, class 2A, class 2B, and 3. And through this tool of UBORA, you can actually, through a questionnaire, a very easy questionnaire, you are able to classify your device. Another important free tool that we have the opportunity to use through UBORA is the regulation checklist. The regulation checklist, also in this case, we have to answer to a questionnaire, and after the questionnaire, you are able to see the ISO standard that you have to follow to design the device compliant with the regulation. They are two free tools available on the platform, and all of you, we will use them for the design part of your device. So at the end, when you have, for example, in work package number 1, you have to identify the clinical needs. So, okay, I have a device, but I have to define which is the clinical need for which the device will operate. And then it's very important for a designer understand which are the existing solutions that are currently available, for example, on the market. And it's very important to identify the intended users, which are the product requirements, and as we have already seen, the device classification and regulation checklist. So when you have completed this work package, with this work package number 1, you can apply for a formal review, which means that all of your group will be followed by different mentors. And when you will finish the work package number 1 and you will apply for a formal review, your mentors will check this part and will give you some feedback, some improvements that you have to do, and then we can go through the other work packages. In particular, after the work package number 1, we have work package number 2, in which you have to define the physical principle, the concept description, and you have to give also some structured information about the device. And then we have the work package number 3, which is from the design point of view, this is very complicated, because in this work package you have to put all your CADs or all your design design CAD, or for example, you have to put the prototype of your software, the prototype of your firmware, and so on. And it's very important, if you have this device under an open source license, also give the instruction for fabrication of the prototypes. And then we have the work package number 4, which is related in particular for the implementation of the device. And in this work package, you will put all the information about the compliance of your device for the ISO standard. And then we have work package number 5, in which it's very important, for example, the business model that you will provide for your product. And then the project closure, the end of your device. Another important section of UBORA is the section related to the resources, in which you can find a lot of teaching material that will help you, for example, to perform a good risk analysis related to your device, and also which are very, very useful for you. There are tutorials on how to use the platform. After this class, we will I will share my screen on the platform, and I will give you a brief explanation on how to create a new device and invite people in the team. But if you have doubts for how I can add this part, or how I can operate on this, there are a lot of tutorials already available on the platform that can help you. Another section is the section for the community. There are in the community, in the UBORA community, we have developers, mentors, managing group, and up to now there are more than 1,000 verified users. And these are some examples of devices that are currently available on the platform. Just to have an idea, I would like to show you this case study, a project on which I worked during the last 2 years. And the name is Palpreast. So breast cancer is the most common invasive cancer in women worldwide, and it is one of the most frequent causes of cancer death in women. It is estimated that worldwide 1 in 8 women will develop breast cancer during her life. And in Italy, for example, 50,000 new cases are discovered each year. The early detection and diagnosis and the early diagnosis are the keys to survive to this fatal disease. And the breast self-examination is the first method to detect early breast cancer, because it is safe and simple to do. The only problem is that this practice is not carried by women because they are not confident on their own ability to detect lump on the breast. For this problem, for this reason, we decided to create Palpreast, a wearable device for breast self-examination. Palpreast is a wearable stretchy top with a pressure sensing textile that is adapted to breast with an inflation system. And this system applies an external pressure to simulate hand movement that detects the presence of nodules, which are stiffer than the breast tissue. The device can be used by all women, including the pregnant ones, because it is safe and not use any radiation. For this reason, also pregnant women can use it. And the proposed solution is a wearable device similar to a stretchy top with an internal pocket, adaptable to breasts with different shapes and sizes. The inflation system is composed by 4 independent air compartments centering on the breast. These chambers, and it is located on the pocket of the top. And there is a graphical interface that will present the results of difference in stiffness region by region. So we worked on the first prototype. In particular, the first prototype was used for the feasibility study. We were able, using UBORA, to classify the device as class 1 medical device according to the medical device regulation. And also we were able to identify the applicable standards. In particular, a very important standard is the standard for the risk management, and also the standard for the biocompatibility of the textile, because it is in contact with the skin. And but currently several improvements towards the device development have been implemented, and this is the new version of the device, and also the interface is changed, and we are currently working on it to improve it. And this one is a very clear example of the UBORA, of the use of UBORA to design our device. For example, this is the risk management table for our device, and it's very important for you, for your device, provide a table similar to this. And on UBORA, in the resource section, as I mentioned before, there is a complete guide in which you can read step by step how to perform a good risk analysis compliant with the ISO standard 14971, which is the standard for the risk management of medical devices. Through UBORA, we were able also to perform a business model, and this one, for example, is the business model that you can create with UBORA based on model canvas. And yes, this is just a call for all of us, because the UBORA platform has been also developed following the principle of the CAWA declaration, a call for of attention for pursuing the democratization of medical technology. And this declaration was signed in the closure of the first International Design School in Nairobi in December 2017. Here is the link. So if you agree with our idea, please sign the declaration. So now I have finished with my presentation, but I would like to show you how to create a new project on UBORA. So just a moment. Can you see my screen?
Yes.
Okay. So here you can do the login. And then here there is the clinical needs section, in which if you have a need, you can write and you can indicate your need. And this one is the section that we will use. So now we have to create, for example, another project. So create a project. Now, just for example, I can put the defibrillator. Okay. So at the beginning, I have to define the clinical need. So for example, monitoring, we have to define the clinical need. So for example, for the defibrillator, because the defibrillator give you a shock if you are in fibrillation, it performs also a monitoring activity. So we can put monitoring purpose. The area is cardiology. Okay. The type of technology, it is about the technology. There are a lot of the list is very long, and for example, in this case, we can put preventive device. No, yes, preventive monitoring device. And then you can add, for example, the keywords. Now I will write 1, 2, 3. Okay. And it's actually the keywords are very, very important, because they will help the designers or people who will go through to the platform to put, for example, in the case of the defibrillator, we have to put heart attack. So heart attack. So if you write something related to heart attack, the defibrillator will appear on the screen. So now I create the project, and it's very important that you will work in a group. So it's important to add member on the project. So for example, I can invite members. In this case, I will write the email of Carmelo. And Carmelo, for example, will be invited by me, invitation sent to participate to the device design. And another important thing that you have to do is to invite the mentor. So all of your groups will have different mentors, and all the mentors and you have to invite all the mentors to your group. For example, I am a mentor of the group number 6. So for the group number 6, when you put on invite mentor, considering that my role in the UBORA platform is mentor, you can see all the name and you can find also my name. Yeah, oh, sorry. Okay, so invite mentor. Group number 6, for example, will invite me to mentoring for mentoring the project. And in this case, for example, I can invite other, it's just an example to show you how to use it. And here you can find the different work packages. So work package number 1 is the first one that you have to complete. As mentioned before, you have to provide a full description, a complete description of the clinical needs, existing solution, intended users, product requirements, device classification, and so on. And at the end, you have to apply for the formal review, because how you can see here, you can't go to the work package number 2, 3, 4, 5, 6, because they are locked. They are locked because you can go through the work package number two only when the mentors have accepted the work that you have done in work package number 1. So when you have completed this part, you have to apply for the formal review, and then you can go through the work package number 1. Here, just to show you some materials. In the resources section, you can go to UBORA teaching material, and here, for example, you can find all the documentation related to how to do a good risk analysis for your device. This is a complete guide, and you can do it and you can follow it very, very easily. And and here on tutorials, there are a lot of tutorials related to, for example, how to create a new project, how to search for a project. This is the reason why the keywords are very important. So how to indicate a clinical need. There are a lot of tutorials that you can use if you have doubts on how to use the platform, or feel free to contact me for every problem that you have. And actually, I have finished. So if you have questions, feel free to do.
Licia, before starting the question, I just would like to explain how it will work in the next few minutes. Okay. So in a while, I will split you automatically into groups according to the email you received. For those people who will be out of those groups for mistakes, for other type of problem, I will directly contact them and eventually include in the specific group. You have to start to discuss with your peers and your mentors, understanding what the device you want to create before actually starting the project on UBORA. So start discussing and identifying what's the best device for you. within your team, it is better to identify what I say project leader, or at best the person in charge to create the project. We can change later, we have this opportunity, but of course it is better to identify a responsible to interact with the platform. This because this person has the opportunity to submit the project for review. This is the only, let's say, skill more than the others. I want also, Licia, if you can show for example, the Palpreast, which is an open source project, so you can go directly and check what it is inside. If you go on all projects, you can look for it. And if you go work package by work package, there is the opportunity to check how, for example, we use the various boxes to indicate our research. So it can be useful for you to look for what we need or what the platform asks. And also there is a place for providing, for uploading project material. It's called the repository. You can upload things about hardware, software, just documentation, and so on. You have to get familiar, of course, it's a new platform. And there is also another important section, it's called assignments, where you can indicate, you can assign a specific task to your team. This is really important for commitment, so you know actually how the things will proceed. For any question, of course, Licia is available. I'm available too, and at least one mentor of your project is already familiar with UBORA. So feel free to ask, feel free to interact, feel free to create also projects for testing. It is there for this reason. The only request is that between the keywords of your project, I'm inviting you to type this keyword is BootCamp 2020. In this way, we are able to immediately identify all the projects you want to submit. Of course, then you can add group 1, group 2, group 3, group 4. It will be easier for us to manage the